Hi, my name is Dr. David Russ. I'm a chiropractor. I practice in Portland, Oregon. Welcome to this video about scoliosis. If you're watching this video, I guess either you or maybe your child has been recently diagnosed with scoliosis and you're wondering, what does this mean? What caused this? What can I do about it? What does this mean for my life? Well, I hope to answer these questions for you, and I hope to do so in a way that, as much as possible, avoids confusing medical jargon and controversy and conflicting opinions. If you're out here on the internet looking for information on scoliosis, then I guess you've been getting some conflicting opinions and maybe seen some controversy about what's possible in terms of correcting the curve and so on and so forth. Well, I've been working with this for about 25 years. I've learned a lot from experience as well as from research, and I hope to help you understand what's going on and what to do about it. I practice in Portland. If you're in Portland or going to be in Portland and you'd like to see me, I'm happy to see you. Appointments with me are not hard to get and not expensive. If you're not in Portland and not coming to Portland, then we can do this over Zoom. I can look at your x-rays over Zoom, and I can look at you over Zoom, and we can talk about what's going on with you and what this means and what can be done. Okay, so let's get into it. First of all, let me say scoliosis is extremely common. It happens to lots of people. In fact, very few people have a perfectly straight spine. On an x-ray, if the curve is measured at 8 or 10 degrees, most radiologists wouldn't even say there is a scoliosis. That's how common these curvatures in the spine are. I myself have a curve of about 10 degrees. I say I have a very, very slight scoliosis. It does affect me slightly. I don't think you can notice it just looking at my body. I don't really have a lot of visible asymmetry, but it's in there. Now, why does this 8 or 10 degree benchmark exist? That if it's less than 8 or 10 degrees, we don't even say there's scoliosis. Well, number one, an x-ray is just a snapshot shadow picture of the bones. And there's a lot of margin for error in there. Sometimes just the patient's positioning can give the appearance of a curve that is not really there. So that's number one. Number two, within the measurement, if there is a curve, there's a lot of margin of error depending on which vertebrae are used to measure the curve and how the lines are drawn, whether it's done by computer or hand. There's margin of error. Some people say 5 degrees, which is a lot. So if you have an 8-degree measured curve, it might actually only be 3 degrees. It might also be 13, which would still be very mild. The point is, it's not an exact science. And finally, when it comes to human development and human anatomy, variation is the rule. Everyone's different. You might, if you were opening a museum and you wanted a human skeleton, you might want to find a typical subject, and I wouldn't use the word normal because there is no such thing. Typical. You might want to find a spine that is extremely straight. Well, good luck with that because very, very few people have that. Another thing to keep in mind when you're looking at these measurements of scoliosis, 8, 10, 12, 16 degrees, is that your spine is segmented. It's not one unit. It's 7 cervical, 12 thoracic, 5 lumbar. That's 24 separate vertebrae. Let's say you have a 12-degree curve, but that 12-degree curve is distributed over 10 segments in the spine. That's really different than a 12-degree curve that's only over 3 or 4 segments of the spine. So the number of degrees is really, it's important, but it's not the only thing we need to look at. We need to look at other things like how many segments are involved and also what is the cause. So let's talk about some of the more common causes of scoliosis. Let's start with the rare causes, and this may be you. There is some underlying disease process in the nervous system or the muscular system that is causing unequal pull of the muscles on the spine. Common ones are cerebral palsy and muscular dystrophy, just to name 2. If that is the case, and there is an underlying disease process that is causing the spine to grow in a curved shape, that is one type of scoliosis. That's one segment of scoliosis patient. More difficult to treat for sure because the underlying disease or process doesn't have a cure. And so those cases are more of like, we want to manage this. We want to help the person understand how to avoid triggers, and give them strategies for self-care and to understand when to seek the care of a professional. Another less common cause is when there is some asymmetry in the skeleton. For example, one leg shorter than the other. So let's say my left leg is shorter than my right. That would cause my pelvis to tilt to the left, which would cause my lower spine to tilt to the left. And my nervous system wants my eyes to be level with the horizon. So it's going to curve me back to the right. It's probably going to go too far. So it's going to curve me back to the left. So I wind up with this S-shaped curve in my spine because one of my legs is shorter than the other. Sometimes people are born or develop a pelvis. That's the ring of the hip bones. That one side is smaller than the other. That basically has the same effect as a short leg. Some people are born with and develop vertebrae that are of unusual shape. Some of them like a wedge shape, or sometimes two vertebrae like wind up connected on one side and not connected on the other. And that'll cause the spine to curve in that direction and then usually curve back in compensation and usually go too far. So you wind up with an S-shaped curve above the vertebra that is of unusual shape. Sometimes even a vertebra in the neck at the top of the spine, if it is of unusual shape, will create a tilt in the head, which will then create a lot of compensation lower in the body. So this is a common cause of scoliosis. There's some asymmetry in the skeleton. But by far, and I mean like 80% of scoliosis in the world has no visible cause. There is no underlying neurological disease. There's no underlying neuromuscular disease. There is no apparent asymmetry in the spine. Just the spine grows with a lateral curvature and a little bit of rotation in it. Sometimes it's a little, 12 degrees, 16 degrees. Sometimes it's like a moderate scoliosis, which would be 18 to 25 degrees. Sometimes it's a moderate to severe scoliosis, which would be maybe like 25 to 40 degrees. Sometimes it would be more of a severe scoliosis over 40 degrees. In all of those cases, you can lead a totally normal life. Okay? It does take work, but the thing is, everybody needs to work on keeping their spine healthy. Everybody needs to do this. People with scoliosis need to do it a little bit more. So the big question on everybody's mind is, can this be corrected? The answer is, most of the time, no, it cannot be completely corrected. If you have a scoliosis that is more than 12 to 16 degrees and you don't have any obvious limb length discrepancy, and someone is telling you that with their treatment, they can get your spine back to zero, I think you should be very skeptical of that claim. That's the most that I'll say about it. I know this is a very controversial topic, and I really don't like to wade into controversy, but that is my opinion based on my experience and my research. Most of the time, the scoliosis can be improved, especially in a younger patient. Now, let's talk a little bit about patient's age and why that's so important. Before you stop growing, your spine becomes what we call skeletally mature, meaning all the bones are formed. When you're a baby and a little kid, your spine is not fully bone. A lot of it is cartilage, which is why kids are so floppy and bounce right back up when they fall and are so flexible. As we get older, the normal process of development is that cartilage turns to bone. Any mechanical structure, if it tilts, gravity is going to want to pull it further into its tilt. And same with your spine. If your spine is sort of curved like this and you don't do anything about it, over time, gravity is going to pull you farther in here. So let's say your baseline scoliosis is here, let's say 16 degrees, but you come into my office and because of gravity and posture, we look at your x-ray and you're 22 degrees. Well, there's things that we can look at on the x-ray to tell us how much flexibility is in there, and we can make a determination of whether or not there's any room for improvement in there. Most of the time, there is room for improvement, again, especially with younger patients. I would say once you're about 25 or 30, it gets harder to change. Not impossible, but it just takes more work. So this brings us to the big question, which is, can my scoliosis be corrected? And the answer is probably not entirely. It can be better. Usually we can make improvement in the curve. We can almost always make improvement in posture. We can almost always make improvement in breathing. We can almost always make improvement in pain, but we can very rarely take a scoliosis that's more than 10 degrees or so and get it to zero. I have seen a few times folks come in, usually younger, with a very slight scoliosis in that 10 to 12 degree range, and with the right adjustments, it goes to basically zero. But that's the rarity. Most of the time, folks come in, the scoliosis typically is 18 to 25 degrees, and there is room for improvement, but not total correction. Once the spine is skeletally mature, it's not going to go back to zero. Even with surgery, it's not going to go back to zero. And if you are considering surgery, you should know that it's not going to correct your scoliosis entirely. It's going to make it better, and it's going to make it stable so it doesn't get worse, but it's not going to make it zero. Is it really important that your spine measures 0 degrees, or is it important that you feel free to move and that you're free of pain and that your breathing is good and that your heart works well and that you feel symmetrical and that your clothes hang symmetrically? I think that's really important. So our goal with our scoliosis treatment that we've been doing for pretty intensively for the last, 11 years is the following. We want to address the compensations that the body has taken on. We want to reduce the need for compensation in the body. By doing that, we're going to make the spine as stable, flexible, and strong as possible. We want to provide the patient, no matter what their age, with a sustainable, long-term strategy for self-management to keep themselves strong, stable, and out of pain. We want to provide them with an understanding of the triggers of pain and the kind of movements and activities that are more likely to injure or more likely to get the scoliosis to progress. And we want to give them the knowledge of when to seek professional help with someone like me. The interesting thing is that's basically what I do for everybody, but with people with scoliosis, it's that much more important. I don't want my patients to come see me every week or every month for the rest of their lives. I do like the long-term relationships I have with my patients, but especially those with scoliosis. It's something that's dear to my heart because I think it's really important and it's so common, and it's a condition that the diagnosis can really cause a lot of confusion and a lot of distress and a lot of anxiety, and that's not necessary. You're going to be okay. What is the best combination of treatment? Well, manual therapy and sometimes adjusting is very, very important to restore pliability to the soft tissues, to adjust the vertebrae that can and need to be adjusted, and to get the spine and the soft tissues into a stable and pliable state as possible. The number two thing, super duper important, is the proper targeted exercise. So you may have heard of the Schroth method. The Schroth method is kind of famous, and if you're looking up scoliosis treatment, you're going to come across the Schroth method. I think the Schroth method is dated, and I think we have better tools than that now. I think that the Schroth method was good for what it was, 50, 80 years ago, but now we have better. We have movement therapies such as Pilates and gyrotonics, gyrokinesis, the Feldenkrais method, the Alexander technique, these things that have been developed and refined more recently, and I think they're better. Personally, I like Pilates for myself and also for my patients. I think that it is extremely supportive. It's very safe. It creates the conditions for a very nice balance of mobility and stability, which is what we want. And most of all, it brings to the practitioner, the person who's doing the Pilates, a great deal of body awareness. And really that is the bottom line, because if you're strong and flexible, it's not as effective if you don't have good body awareness, you don't know where your limbs are, and you're not sure how to move them. The third thing that we really like to do with scoliosis folks is breath work. Big effect of scoliosis, especially in the middle back, is a distortion of the rib cage, which creates difficulty with respiration, breathing problems. So asthma and scoliosis go hand in hand. A lot of breathing issues go with scoliosis, and that is totally can be addressed with breath work. So breath work, meaning learning how to breathe, learning about the breathing mechanism in your body and how to make the most use of it, along with Pilates or something similar, teaching you how to move and helping you be strong and stable. And then body work, hands-on manual therapy to get all of the rib muscles and rib joints and shoulders and lumbar spine and cervical spine as mobile and as stable as possible will get you, even with a scoliosis, to a place where you're functional. Pain-free, you can do the things that you want to do. You just might have to put a little bit more effort into it to get there than a person who doesn't have a scoliosis. Another question we get, a very good question, is when is surgery necessary? Most of the time, the surgical candidate, whether adolescent or adult, is in a lot of pain, has had conservative therapy like what I'm describing, and it has not gotten better. And because of the curve, there is some compromise or some issues with heart, breathing, or digestive function. Because when the spine curves severely, it will compress those organs and it will make it hard for the person to breathe, or make it hard for the person's heart to pump blood effectively, or make it hard for the person to digest their food. If those things are in place, that's a surgical referral. And the surgeries that are available now are much better than the ones that we had when I was a kid. You'll also notice very few kids wearing braces anymore. When I was a kid growing up, there were a few people in my high school that wore braces, and they were really obvious, and they were bulky and terrible for the kid who's got to walk around with this basically cage on their body. Creates a lot of anxiety and social awkwardness, and thank goodness we don't do that anymore. We don't need to do that anymore. There are braces out there that are much more discreet and comfortable, and so people might be wearing them and you wouldn't know. So bracing is sometimes necessary. The braces are best used when the scoliosis is more than mild. It's in that moderate category, but not so severe that it's a surgical case, and when the person is still growing. If you're still growing and your spine is not mature, then you might be a candidate to wear a brace. But if that's the case, again, I want to say it's not super bulky, it's not super uncomfortable, it's going to be made and conformed exactly to your body, and it's going to be something that you can wear without too much interference in your day-to-day. The things that really concern me as a provider when I see it, number one is when the curve is progressing rapidly despite treatment. And by rapidly, I mean, 5 or 10 degrees a year. If that's happening, that's concerning. But again, that's very rare. And if that's not happening to you, that's a good thing. If you're just learning that you have scoliosis and you kind of just got your first x-ray, and I want to tell you, you should get another set of x-rays in 6 months and another set in a year and probably another one 6 months after that. And if it looks pretty much the same on all three, you can be very assured that it's probably pretty stable and it's probably not going to get worse, and that with body work and breath work and the correct exercise, you're going to be just fine. I think I've talked about 20 minutes. That's probably enough for now. If you're still watching, maybe you should reach out. We can have a conversation over Zoom, or you can come in person, and we can talk about your situation or your child's situation. I would like you to have the correct information, because incorrect information, conflicting and confusing information causes a lot of unnecessary anxiety and distress, and we don't need to go there. So let's look at your x-rays, let's see exactly what's going on, and let's make a plan for you. So this is Dr. Russ in Portland. Really appreciate you watching, and I welcome your comments, and I welcome you to reach out to me. My contact link will be in the video description. So